Welcome to the CHCI Fall Health Summit panel, Leading the Way, Diversity, Equity, and Inclusion in Healthcare. We are grateful to our sponsors, Blue Cross Blue Shield Association, Bristol Myers Squibb, and the American Federation of Teachers. Our panel host for today will be Congressman Jim Costa, representing California's 16th Congressional District. He has served the San Joaquin Valley in the U.S. House of Representatives since January of 2005. He serves on 3 powerful House committees: the Committee on Agriculture, the Committee on Natural Resources, and the Committee on Foreign Affairs. Congressman Costa will serve as a panelist for this session. We have welcoming remarks from Keisha Brooks-Coley, Vice President of Advocacy for the Blue Cross Blue Shield Association. Our moderator for today's session is Ana B. Ibarra, a California-based health reporter covering state policy and the pandemic for Cal Matters. She previously worked at Kaiser Health News, and her work has appeared in the Washington Post, the Los Angeles Times, USA Today, and other news outlets. Please welcome Keisha Brooks-Coley, followed by our moderator, Ana B. Ibarra.
Good afternoon. I am Keisha Brooks-Coley, and I am Vice President of Advocacy with the Blue Cross Blue Shield Association. On behalf of our 35 community-based, independently operated health plans, I am so pleased to be here with you all today as we dive deeper into this very important topic of diversity, equity, and inclusion in healthcare. Racial and ethnic inequities and disparities have existed in our healthcare system for far too long. For generations, people of color have experienced the U.S. health system differently when compared to white Americans. Institutional bias and systemic racism have led to drastic and worsening disparities and inequities. This, coupled with cultural and language barriers, as well as higher uninsurance rates and limited access to preventative care, mean large portions of our population are not getting the care they need when they need it. While there is no easy or simple solution, we need to look at how we can make our healthcare system work for everyone. For the last 18 months, we have all been impacted by COVID-19, but the pandemic did not affect us all equally. COVID-19 disproportionately impacted communities of color and sharpened the focus on racial health disparities. Compared to whites, Hispanic individuals and Latinos are nearly 2 times as likely to get COVID, 2.8 times more likely to be hospitalized by the virus, and 2.3 times more likely to die. This is unacceptable. According to the 2019 census, Hispanics make up nearly 20% of the U.S. population, but have the highest rate of uninsurance of any ethnic group in the country. Healthcare is unattainable and unaffordable for too many. Blue Cross and Blue Shield companies across the country are working to identify and address this ongoing crisis and change the trajectory, creating a more equitable health care system. Which is why earlier this year, we launched a multi-year national health equity strategy, featuring a comprehensive series of initiatives that rely on close collaboration with healthcare providers, community leaders, and advocates. No one can solve this problem alone, but I know together we can build a better, more equitable healthcare system that meets the needs of all Americans, regardless of where they live or the color of their skin. As a health insurer that covers 1 in 3 Americans, we look forward to partnering with CHCI and other stakeholder groups to address health disparities and to identify policy solutions that will have a true impact on people's lives.
Good afternoon. My name is Ana Ibarra, and I am a health reporter for Cal Matters, a nonprofit news outlet covering California policy and politics. It is a pleasure to be here today with you all and leading this discussion. Thank you to Keisha Brooks-Coley for setting the stage with her opening remarks. And thank you to CHCI for hosting this health summit and focusing attention on the important topic of diversity, equity, and inclusion in healthcare. So a bit about this session. Lately, as Keisha pointed out, the general public has been hearing the terms health disparities and health equity quite a bit in light of the pandemic. But people in the healthcare space know these issues go way back. When it comes to Latinos in America specifically, we know they are one of the demographics least likely to see a doctor. Beyond issues of access, ensuring that our healthcare providers have the culturally competent tools to provide adequate and holistic care for Latino patients is essential. In this session, we have 3 leaders who are prioritizing diversity, equity, and inclusion in their workforce, and who will talk with us about why building a pipeline of Latino healthcare providers is a crucial element to achieving health equity for Latino communities. First, please welcome Representative Jim Costa of California's 16th District, which covers Fresno and the central San Joaquin Valley. Congressman Costa has served the San Joaquin Valley in the U.S. House of Representatives since January 2005. Representative Costa introduced the 2021 Expanding Medical Education Act, which seeks to establish a grant program to support schools of medicine and schools of osteopathic medicine in underserved areas. Congressman Costa, welcome.
Well, thank you very much, Anna, and I want to thank Leticia for her opening comments. When we think about it, it is fitting and appropriate that diversity, equity, and inclusion in healthcare be the focus of today's discussion. And I want to thank CHCI for hosting this important panel because truly the work that we are doing not only on the president's signing of the bipartisan infrastructure package, but the Build Back Better is really to focus on a host of challenges facing our country in terms of investing in its people. And really, we began with that effort back in March with the Rescue America plan to really try to provide support for the challenges in our healthcare system as it relates to this pandemic. But, you know, I appreciated the comments that were noted about the disparities because for the 20 months that we've dealt with this horrific pandemic in our country and really throughout the world, with over 700,000 Americans' lives that have been lost, as our previous speaker noted, it's impacted our minority communities to a much greater degree. That's just to be a fact. And so some of the inequities and social challenges that we face because of language, because of culture, because of other factors existed before the pandemic. And for those of us who represent large minority communities, we've been aware of that. But this pandemic, I hope, for those who have not been aware, like taking a Band-Aid off a wound, has exposed, I think, dramatically these very deep social and economic challenges that we have. As was noted, I'm sorry?
I was going to thank you. I think we'll get into this a bit more in our first question. But let me welcome Dr. Leticia Ferry, the Executive Director for Worldwide Medical Cardiovascular for Early Assets and Business Development Strategy at Bristol Myers Squibb. With BMS since 2010, Dr. Ferry has held many positions with the company, including as the lead for OLA, Organization for Latino Achievement. Originally from Brazil, Dr. Ferry holds many degrees, including an MD, PhD, and MBA. Thank you for joining us, Dr. Ferry.
Thank you so much, Anna. It's a pleasure to be here with you, and I'm looking forward to discussion on this important topic. Thank you.
Great. And finally, Ana Cecilia Delgado Santana, a nurse and healthcare case manager with Rutgers University FXB Child Health Unit. Ana Cecilia is a contractor to the state of New Jersey, working alongside the Division of Child Protection and Permanency, verifying that the children in care are either getting back on track with their medical needs or that they continue to maintain services without a break in care. Thanks for being with us, Ana Cecilia. Oh, I think you're muted. Please feel free to tweet your comments about the session at hashtag CI Summit, and we'd love to see what questions you have for the panel. Please feel free to type your questions into the chat box. So I'm going to jump in with my first question. And for all panelists, let's discuss some of the factors behind why building a strong workforce within healthcare has been a challenge because this isn't new. We've heard of the Latino provider shortage for decades. So why do you think it's been difficult to build a pipeline of health care providers? And Dr. Ferry, let's start with you. Can you hear me, Dr. Ferry? Do you want?
Oh, yes, I can hear you. Sorry. Yeah, so I think the first problem that we need to talk is really representation. And it's hard for people to want to be in a career where they cannot see which are the possibilities. So that's why I think it's critical for all of us to ensure, for us who are already on the field, to make sure we get active and we show others all the possibilities and what we can achieve, so we can inspire and support the others who are come. So they need to see people who are like them, who speak like them, like in my case, have an accent or not, that are like us, that dress like us. So that's really important. And I think that can sometimes, it's really relevant for us to talk about it. Also, I want to talk about what BMS, where I'm working, what BMS has been doing. And BMS as well, for the workforce, we did some aspirational goals and really holding ourselves accountable for it. So for Latinos, especially like here, the community we're talking about, for the Latinos, for the end of next year, 2022, we do want to double the numbers of Latino executives in the US. And this is not, we published last year, so it's a public available, our commitment. So we are showing where we are and where we want to be. So we are not yet where we would like to be, but we are making that transparency and making those transparency and really making sure we do more and we get where we should be.
Thank you. Ana Cecilia, if you want to add to that, why do you think it's been difficult to build a pipeline of Latino healthcare providers?
Are you able to hear me now?
Yes.
Okay. So yeah, I want to say that I'm proud to be representing my union, HPAE, Health Professionals and Allied Employees, and the largest union of registered nurses and health professionals in New Jersey. So that's one way to go, is always get involved with your union. And nationally, we're represented by the American Federation of Teachers. AFT does represent more than 200,000 nurses and health professionals, and it's the fastest growing healthcare union in the AFL-CIO. So whenever in doubt, reach out to the union. We don't just have a shortage of healthcare workers. We have a shortage of culturally compassionate, competent care because we haven't invested in Latino students and our workers. The latest data from the U.S. Census Bureau tells us that 18.5% of this country is Hispanic, but we don't see that reflected, right? According to the Bureau of Labor Statistics, only 8% of registered nurses are Hispanic or Latino. Another sad reality is that there are 41,700 DACA recipients who are essential healthcare workers, and only 11 states allow DACA recipients to get a nursing license. Just imagine how much of an impact that could have on our workforce. We also have to think about every step in the pipeline, from early childhood education to professional development and licensure. We need to fund education programs that get students excited about health careers. And we have to make the higher education programs and certifications they need to enter the workforce affordable and accessible. Fighting for better working conditions now isn't just about us. It's about the future of healthcare. If we don't address unsafe staffing and burnout in the current workforce, we're not just hurting current healthcare workers, we're also signaling to our students that this isn't a sustainable career.
Thank you. And Congressman Costa, to this question, I was wondering if you can talk a bit about some of the work you've been doing in your role to help address some of these gaps in the health workforce.
Well, I appreciate that. I introduced legislation several years ago, and I'm hoping it will stay in the Build Back Better plan that will provide $500 million throughout the country for regions that are underserved as it relates to medical care, primarily physicians, but also nurses as well. And I'll take the San Joaquin Valley as an example. I have a minority majority district, and prior to the pandemic in 2010, when I voted for the Affordable Health Care Act, almost 25% of my constituents had no health care insurance whatsoever, none, and 17% were underinsured. But as a result of the $8 billion we provided to rural health care clinics, not only in the Valley, but throughout the country, today, 10% of my constituents have no health care insurance, and the underinsured number has dropped significantly. And we've expanded clinics in rural areas for which there is no other alternative for health care. But we need to do more in terms of broadband. If under telelearning or telemedicine, it's hard enough, if you don't have access to broadband, forget it. But I think the comments that were made earlier about how we get Latino and other peoples of color in our healthcare workforce is really the challenge we're facing. My legislation, if it becomes law, and Secretary Becerra, an old friend of mine, whose wife some of you may know is a physician, and she's from the Fresno area. But you look at Fresno State, my alma mater, go Bulldogs, 25,000 students. Over 70% of the students there, the student body, are the first in their families to go to university. And UC Merced, that I also represent with 9,400 students, has over 70% of its students that are the first in their family to go to university. And we are developing, the governor is committed, again, as an example, $200 million for a medical science school at UC Merced, and $5 million a year for the next 5 years, $25 million. This federal legislation would partner with the state of California in a very significantly underserved area to put a medical school there through a very cost-efficient message. The undergraduate school would be done at UC Merced, and then the graduate program would be done with the existing hospital and healthcare clinic system in the greater Fresno area, much like the UC Riverside, with a priority upon training minority physicians, with a priority on the training of minority physicians that are multilingual capability and that understand the various cultures that exist, even with the country of Mexico, which we know has a lot of various important subgroups that have language issues, that have cultural barriers. But the way that we've got to do this is we've got to provide more medical schools, not just for physicians, but for nurses as well. At Fresno City College, our community colleges are a very important source of training. With Fresno State, we are developing a bridge program to expand the nurses. You know, I want to close on this note. There are lessons to be learned from this pandemic. And one of those is if you have a shortage of personal protective equipment, in a matter of months, you can produce masks. But if you have a shortage of physicians, if you have a shortage of nurses, you can't produce those overnight. And so the Speaker of the House is very supportive of this legislation, as is Representative Anna Eshoo and others, because they know we need to train more minority physicians and healthcare specialists to really meet the needs of our communities of color throughout the country.
Great, thank you for that. And I actually started my reporting career in Merced, and I've been hearing and seeing the push for this medical school for many, many years now. So it's neat to see, some of that work come to fruition now.
We're
So,
almost there, Anna. The governor made the announcement last month on the $200 million. So
yep.
we just got to get this bill signed by the president.
Great. So, Ana Cecilia, let's go to you. I'm wondering if there are any areas in healthcare where you think the need for Latino representation is especially urgent. I know you mentioned, there's a shortage of representation, culturally competent representation uh, across the sectors, but I'm wondering if there's any specific sector within healthcare where you think the need is especially urgent.
Right. So I currently provide services for children who have been removed from their families and are in the state's care. For reunification to occur, a judge will typically order for services or assessments to be completed. These can include psychological, psychiatric, bonding, neuropsychological evaluations, and so on. Seeking out providers to complete these evaluations in English is already complicated enough. So if you factor in the language and cultural aspect, it only magnifies the problem. From my perspective, the lack of culturally competent mental health providers is immense. This is not to say the issue is not the same in other specialty areas. However, the reunification of a family is based on the results of these reports. And the longer it takes to identify someone that can complete them, the longer a family will sit in distress. We also have to be strong enough to know that we are not one size fits all. In my experiences, one of the biggest factors in treatment is connection. This goes beyond whether or not the client is even willing to move forward. Creating our own internal network of knowing where we are and what specialties we practice is vital. Here's the name of a local Ecuadorian primary care provider, right? Or what about a Puerto Rican dentist? You should feel confident in saying this is where else you can seek out those services. As we all know, when it comes to our own healthcare, options are important. Second opinions matter, and we need to give our people the same courtesy by providing them with those types of options.
Great. And on the flip side, and maybe Dr. Ferry, you can take this. I'm wondering if there are any roles or jobs within healthcare where we do see Latinos well represented, and what are those, and why do you think that is?
Yeah. So, Anna, I just want to start saying that absolutely we should have more. And I wish, like, across all areas, we would see those stars. But I think, like I mentioned before, it's important that at least we start to highlight everyone who are on those areas, that we start to highlight them and have them as role models. So at BMS, at least I'm glad to share with you that the company has put a big commitment with the Latino community. And we do have, this was my previous role before this my current role. I was the full-time lead for OLA, that's the Organization for Latino Achievement. So BMS is really putting an effort here at our company to make sure we do have voice at the senior leadership, and as well that we can empower and bring others along the way, like I was telling you on our commitment.
Great. So let's move on to, I'm curious, and I'd love to hear from both Dr. Ferry and Ana Cecilia. What made you want to become a nurse and a doctor? From your experience, how can we support more Latino students in pursuing health careers? And how can we support them once they're in the workforce? Ana Cecilia, let's start with you.
So when I decided to go to nursing school, honestly, I still wasn't sure why I wanted to be a nurse until I came across one patient. In my nursing school, we would go into the hospital the night before our clinical rotation. We would receive our assignment for the following day, go home, create a treatment plan, return the next day, and put the plan into action. I had one patient. She was trach. She had a tube down her throat, but she was conscious. She was in an excruciating pain. She had several complex issues, and she continuously rang that call bell. She kept asking for pain meds she wasn't due for. I just kept trying, readjusting her, ice, warm compresses, anything I could, up to the point where my nurse I was partnered with told me not to go back in. But I couldn't. I just couldn't not go in. And of course, she rang that bell again. Remember, she's trached, she cannot speak. I profusely apologized and said I cannot give her anything else right now, and she mouthed something unintelligible. It took me a minute to figure out that she was asking me to brush her hair. I had bathed her, turned her, fed her, but no, I had not brushed her hair. This crossed all barriers for me: culture, ethnicity, race. That was the moment I knew that this is where I belonged, truly. Remember, Latinos, students need to see Latino healthcare workers with a seat at the table. Being a
Yep.
union leader allows me to bring my perspective to that table. All the medical logistical advances in the world mean nothing if we can't take a few minutes out of our day to understand that brushing someone's hair can make a difference. That asking questions as to whether or not someone's beliefs align with the projected plan, and is it okay for me as a man or a
Mhm.
woman to treat you? It's also not just about getting people into the workforce. We must then support them when they get here. Even before the pandemic, burnout was a huge issue in the healthcare workforce, and it's only gotten worse. Burnout is real. I myself am not actively working in a hospital, and I can tell you I have experienced more death and loss this year than ever before. Our own mental health well-beings are at stake. So you can so can you imagine how difficult it must be for our vulnerable populations? People are not only leaving the healthcare workforce, they are also forced out to go out on medical leaves, which leaves the rest of the team to pick up the pieces. Use your mental health days, be kind to one another, and I say this with as much respect as possible. Let's try not to eat our young. We need all the help that we can get.
If I may, let me
Yes.
just commend you. You're part of the heroines and heroes of the healthcare workforce over the last 20 months that have risked your own lives and your families and children to go into hospitals, healthcare facilities, nursing homes, um, where the pandemic has spiked, and nonetheless puts your focus on humankind and helping those who most need it. And I also want to thank you for noting out the importance for mental health, because we see it taking place in every aspect of this pandemic. In Fresno Unified School District, which is the third largest in California, they've expanded from 60 psychologists to over 90. The rate of students who have contemplated suicide or who have attempted it is very frightening. And so I think our conversation here to reach out to our minority communities and provide support not only for the current healthcare workers, but expand Pell Grants so that we can make it economically viable, and to also provide tax incentives for people who, upon graduating nursing and physician programs, will practice in areas that is most in need, where we have an underserved population. And that's really what we're talking about here today. Thank you. Thank you, muchas gracias, for all that you've done.
Thank you, Representative Costa.
Yes, thank you. And Dr. Ferry, I'd love to still pose the question to you. You know, what made you want to become a doctor, and you know, and how can we support Latino students in pursuing health careers?
Yeah, thank you, Anna. And I reflecting back when you asked this question, I think I was very fortunate because I need to say I had a role model, an example at home. So my father is a doctor, and so I had that in front of me, like the example that Ana Cecilia mentioned. And we did live in a very rural area in Brazil, so I would see that every day. People coming in front of our house, bringing gifts, milk, chickens, all kind of things, as part of being a very tight community. So I could see immediately the impact and the importance that we would have on the community. I need to say that although as well I had him as my role model example, it's interesting as I reflect back, there was no women. When I think about on that time in Brazil, and thinking about my father and all his colleagues in the hospital, I would go with him to the hospital sometimes for the rounds in the morning and have coffee or tea there. I never saw any women there. So it's good to see how much has changed. But I really, going back, I really think like Anna was saying, it's critical for us to start to show the impact and how important there is. I also want to share one thing then after what happened when I joined the industry. And I think as well, for now, for me, being in the industry and knowing the importance of pharma industry in the science and the bringing innovative medicines to health is important as well that we start to bring more Latinos and other groups to work with us. And unfortunately, most of our community don't know all the possibilities. So when I reflect back, and sometimes people ask me how you joined pharma, I'm like, I really don't know. Somehow it came to me, and I wasn't in interview. I wasn't even sure what I could do. And unfortunately, this is what happened with many physicians. So like Representative Costa was mentioning, we do have that lack of pipeline. We don't have enough physicians. And those who have achieved are already there. Many of them don't even know the possibilities, don't know how to become investigators, don't know how to come here to join pharma. So we still have those disparities, even for those of us who finish medical school and finish residency. So I think, like Anna was saying, we need to support people along all the way. And so this is kind of, I think, Anna putting some reflection on my career and as well what else we need to do to bring more Latino colleagues to pharma or to science and to research.
Mm-hmm. And I'm curious, either Dr. Ferry and Cecilia, if you see any examples of programs out there that are doing a good job of this, maybe within your own jobs or just examples nationally that you think are maybe, that's what we should be looking for or looking toward, either of you?
Do you want me to start, Ana Cecilia?
Go ahead.
Yeah. So I will share one example that ties back to what I was saying, and we discussed a little bit about diversity in clinical trials and how to bring patients, Latino patients, diverse patients that reflect our population to our trials. And as part of that, like there is the trust, and patients are more willing to be part of a study, or they connect much better if they have a doctor or a healthcare provider, a nurse, a multi-professional group that looks like them. But as we are looking into that, sometimes it's not easy because those professionals are not out there. So as an example, we can start to put all those efforts, but we need to help them and teach them how you can become an investigator. And this is one example that I would like to share. So the BMS Foundation now is supporting 250 healthcare professionals to become investigators. So helping people on where are those diverse communities and teach them, supporting them on their career. If you want to become an investigator of clinical trials, what you need to do, and supporting them along the way. And the other thing as well, just to add on that, on the trials as well, we need to make sure we go to where those communities are. We cannot ask patients to travel hours to get to a center where they can get access to those innovative drugs or that kind of research. So that's the other thing as well that we have been doing, and I know this has been an effort across pharma, really to have more investigators and as well have those centers where those patients are. So at BMS, we did put a goal to have 25% of our centers in those diverse communities by the end of next year. So that's the only way. We need to go where those patients are, and we need to support those clinical teams.
I do want to go ahead and move on because I have a couple questions about, the pandemic, right? We're still in the midst of it. And one thing we're dealing with now, and that we've been covering is sort of this trust in our healthcare system and trust in things like vaccines. So I'm curious, how do we build that trust and relationships with Latino communities and the healthcare system? And Congressman Costa, I'd love to start with you because specifically, I think there's also maybe this some of the mistrust in vaccines or hesitancy is part of some mistrust in the government. So I'm wondering what you think, government should be doing or is doing to help repair that trust between the public health and government.
There's a lot of feedback in your comments, so I hope I get your questions correctly, and that is the vaccine disparities, the lack of trust, and the other barriers that have made it difficult for us to achieve the vaccination rates that we need to have. Was that the question?
Yes, yes. How do we repair that trust?
Right. Well, again, the feedback here is significant, but I will speak slowly. The pandemic, as I said early, has taught us many things. Among those is that public health is critical. And I think prior to the pandemic, we tended to ignore or not place the proper emphasis on our public health departments in our counties, whether they be in California or throughout the country. I have worked very closely with the 3 county health departments in my constituency, Fresno, Madera, and Merced. And with a lot of rural communities, the ability to get access to provide the education is critical. Of course, before we had the vaccines, trying to get people to practice good public health standards is hard. And there has been a whole education in that effort. And we talk about critical workers. Well, many of the campesinos, that are out in the fields that are producing food that goes on America's dinner table are essential workers. And there's many other workers that have been classified as essential workers, but yet with limited personal protective equipment as they do their work. And so that was a real challenge in the last year. We've made progress, but we must make more. When the vaccines came out last January, we found many communities, not only in California, but throughout the country, that didn't have access to those vaccines. So with our public health departments, we began to create mobile centers to take the vaccines to where the people were. But even that is a challenge because of the language barriers and culture barriers. We've had to do a whole education process. And sadly, the misinformation that we've seen, and this is something I really get very frustrated about, with social media about the efficacy, the safety of vaccines has spread to our minority communities, misinformation. And that has been another challenge that we've had to deal with. But we have worked, in my own experience, with our public health departments, with the small rural communities like in Mendota and Fireball and other valley, with our schools, and also with employers, with agriculture employers that employ 100 or more employees. We've actually brought up a mobile clinic and offered everybody a vaccine. But there are some that are still reluctant to take the vaccine. And so I think the efforts to educate in Spanish radio and television We've worked with Univision and Telemundo and other efforts to try to make people understand that this is for their health, for their family's health, and everybody they work with. We've made progress, but we still have, let me give you an example. In Fresno County, 1 million people, we now have over 60% that are fully vaccinated. But still, that means that over 30% of the population is not. And in Kings County, south of us, we have the lowest vaccination rate in California. With the variant and wintertime coming and more people confined to, being inside as opposed to being outside, I'm very fearful that we might get more spikes, especially in our minority communities. The work still needs to continue on all of these efforts.
Great, thank you. And I think it's time for us to move to some of the audience questions. So if you have some questions, please drop them in the chat box and I will read them as they come. So let's see here. We have a couple questions already. So first question is asking, are there great programs and or universities that are effective at increasing Latinx representation in the health fields, whether it be nursing, midwives, doctors, etc.? I'm not sure if Cecilia or Dr. Ferry might want to take this.
So I'm not necessarily familiar with particular schools, but I know that the unions provide a lot of support and backing and guidance, and they also partner with the universities as far as getting us discounts and different things. It all depends on what type of program you're searching for. In 2018, AFT passed a resolution focusing on making health equity a national priority. We're focusing on building and representing a healthcare workforce that reflects the communities we serve. So what better way to get a seat at the table than to partner up with your union? As far as academics and stuff like that, they're making those same connections.
Great.
And let me just add, and I think as well what I would advise to students who are looking for support now, you can just reach out to some organizations, for example, Prospenica, HISPA, and these organizations, SHEP. So these organizations, they might help to kind of thinking about network. If they don't have anything in place right now, they might be able to help you to connect to other people. So my first advice, like, don't be shy, just be proactive, reach out to all of us who are here on this panel today and to those organizations. So I'm sure people will be willing, and that would be my first thing. Like, we can't afford this anymore to stand on the sidelines. We all need to be engaged and supporting each other.
Great.
Let me just add, if I might, because they've just called the roll on votes, and so I've got 9 minutes to get over to the House floor to vote, and that's part of my job. And I'm really thankful that you would include me as a part of this important panel that CHCI is dealing with diversity, equity, and inclusion of healthcare, because it's an issue that I care deeply about. We passed a resolution. There's a lot of different ways we can strategize, and I think all of these efforts strategizing together make a difference. But we had National Latina Nurses Day, recognizing Latina nurses and their contributions throughout our country. And the reason I mentioned my own constituency, because both Fresno State and UC Merced are minority majority campuses. And so what a better way to train minority physicians where you already have universities in which the majority of the student body there are minorities, right? And so that's why this partnership that we're trying to put together between UC Merced and Fresno State to build a medical school is so important, because we have found in a program that we have with UCSF, University of San Francisco in California, that has been for 40 plus years in the Valley, that half the residents, Leticia, that have completed their residency program there have stayed to practice in the Valley. And what a better way to deal with the shortages, because you have people who went to school there, and they know they have the passion like you do, Anna, where they have an ability to really give back in a meaningful way. And so it's been proven that if you have nursing schools and medical schools in areas that are underserved, the likelihood is that the nurses that graduate, the physicians that graduate, are going to stay to practice in those communities where they did their training. And so I'm very excited about it, as you can see, and passionate from the corazón. And so, again, thank you so much. But I need to get back to the floor and vote. I don't know if maybe that concludes my closing comments. But I really thank all of you for your passion and for your efforts, because it's a team effort. The Hispanic Caucus, of which I'm a member of, is wholeheartedly supporting these legislative initiatives, as well as comprehensive immigration reform, which has always been our number one priority. But we must work on all of the above, and we're not out of the woods yet in this pandemic. We have more work to do. I'm sure our nurse and our physician here that are part of this panel can say much better than I can how we have to stay focused because of the impacts that this horrific COVID has had upon our people of color and our minority communities. And so we must stay focused and do more. But thank you for allowing me to be a part of this. I really appreciate it very much.
Thank you, Congressman Costa, for being with us and sharing your thoughts and time.
Okay,
So
thank you.
we'll move on to the second audience question. We have here, besides diversity training, what can healthcare companies do to increase the cultural competency of its workforce to better serve communities of color? Dr. Ferry or Ana Cecilia, whoever wants to take this one.
So I would say it's important to get involved in your community, right? Like, the community is really there. They're integrated already. The COVID pandemic showed us that, right? We saw all of the openings for the vaccines and the testing happen there at the schools, right? So our school nurses, social workers, counselors, all of them, in many cases, are access points into the healthcare system. And nationally, those roles tend to be a bit more diverse than the healthcare titles, right? Child, family, and school social workers are 21% Hispanic or Latino, according to the latest data from the Bureau of Statistics. So exactly why those numbers are higher, I'm not sure, but AFT and HPAE both continuously spread the message that coordinating healthcare and social services to address the needs beyond just treating a health condition is absolutely necessary. Children enter out-of-home placement for a variety of reasons, whether it be for the child's or the family's own needs, and these community contacts are our first line of defense. So I would say partner up, engross yourself into your community, reach out to your schools. As a taxpayer, you can go into those schools and make those connections with those mandated reporters, right? You can make that connection there, bring it back into your own treatment care.
Oh, I think we lost Ana Cecilia. But we'll go on to the next question. And Dr. Fair, I think you're the only one left on here. So, this third question is, while many healthcare organizations focus on DEI work, diversity and inclusion work, it is sometimes undervalued. What can healthcare organizations do to get full buy-in from their workforce?
Excellent, Anna. And in fact, this was attached to a comment that I would make to the previous question. And I will share what we have done here at BMS, and that has worked really well. So we needed to start to link D&I to the business and what is the economic impact and like to health. So what here we have done at BMS and that across for all groups that we have, like usually are called ERGs, but at BMS we call them PBRG. So it's people in business resource groups, because we are much more than being a cultural group and people who have a lot of similarities. We do bring insights. We can help. We really can bring a lot of how to bring innovation. For example, to bring innovative medicines, to change healthcare, we need to bring innovation. And for that, we do need to have those diverse voices. So my main advice is like, think about what you could deliver your group. And you can start small. What is one thing that you could bring? Which kind of insights that you could bring to your company or to your organization, to the university, to show what is the impact? Bringing more people on recruitment. So think about that. I think as soon as people start to see that we have a plan, that there is an impact that we are going to create, all those voices will start to be heard. And there is one point like, okay, we can't, we will start to make an impact. So that would be my advice, Anna.
Mm-hmm. Our next question, maybe Anna, Cecilia, I think you're back. You can take this one because you talked a bit about it in our earlier discussion. What can be done to prepare doctors and healthcare staff to be more culturally competent in the hospital setting?
Oh, don't we all wish to be perfect? So coordinating services for our families becomes more difficult with each passing day, right? I would say getting involved politically, keeping up with those changes in your area, as they play a huge role in how vulnerable populations are affected. If you're unsure of how to start this process and are lucky enough to work in a unionized facility, seek them out. Each union has its own designated committee on political education, also referred to as COPE. This group takes an active role in picking out politicians, like Representative Costa, that align with your union's values. Be the first one in line to advocate for your clients and ask the questions that matter to all. Lastly, tell your union that you are willing to connect with fellow Latinos. You never know what fight another group may have already conquered or if they need backup, and use that knowledge that you gain to fight your own fights. Now, if you don't have a union in your workplace, let us know. Feel free to reach out and maybe we can make that happen for you also.
Great. And there's a question here that you sort of touched on some of those organizations. It says, are there any organizations that support Hispanic Latinx health professionals and provide them with resources that focus on their Hispanic Latinx patients? Dr. Ferry, do you want to repeat some of the ones you mentioned earlier?
Yeah, so those organizations that I mentioned earlier is more thinking about STEM and the pipeline, so helping people to reach to have healthcare careers. I don't think those might be helpful. I just want to mention like some organizations is the National Hispanic Medical Association, kind of now switching organizations, and the Hispanic Nurse Association. I think those are good ones for us to think. But I also would call out, like Anna was saying, we might need to look depending where you are and to look for local organizations, because we have those national organizations. Another one that it's good that now the organizations are coming back. The other one is Unidos. And Unidos, maybe you can go to their website and take a look, because Unidos is a national organization, but they have many local chapters or organizations that are partner of this big umbrella of Unidos US. And maybe you need to start to look, because sometimes to be effective, you needed to really to understand like who the community trusts and who is part of them. Because otherwise, if you come with a new organization, then it's just one more barrier until that local community starts to trust them. So I would look at those organizations, US, National Hispanic Medical Association, and the Hispanic Nurse Association.
Great. So we are getting here to the end of our session, and I would like to give you each a minute for final thoughts. Anything you want to leave the audience with. Ana Cecilia, let's start with you.
I just want to remind everyone to check in with your communities regularly. I see an influx in immigrant families coming in right now. Before Guatemalan, so it changes. So I have to brush up on how to meet the needs of my clients, before I go out and do my visits and interact with them. So I suggest you all do the same. And, just remember when we talk about successes, doing what you do every day is success. Just being there for that one patient, that one client, can make a difference in their day as well as yours. It doesn't have to be a grand gesture. This could be why you're here every day to get up there. So remember that the last time you talked to this child, they said they wanted to be a doctor. Check in with that. Is that what you still want to do now? My notes and my questions are much different now than when I first started. But you could, be that one consistent person every time they come in, and use that to your advantage. It's a platform in its own right. Don't wait for other people to do it for you. Just seize the day.
Thanks. Dr. Ferry?
Yeah, so Anna, I would just summarize as get involved and don't think what you can do is too small. We all need to do. So we start to doing what you can. And I think we cannot change this alone. We need all of us to get involved. So just get involved, reach out to us and start to support each other and bring network. That's the only way we'll be able to change this in the coming years.
Great. Well, thank you both. I myself have learned a lot from just speaking with you guys and hearing you all. I think this session gave us a lot of things to think about and maybe take back to our workplace. I, for example, will have several ideas just from our conversation here that could be something I look into for a story, for example. So I really want to thank our great panelists for this thoughtful discussion, Congressman Jim Costa, Dr. Leticia Ferry, and Ana Cecilia Delgado Santana. Thank you all. Please keep tweeting about the Health Summit at #CHCI Summit. We have a full slate of sessions scheduled for today, including panel discussions on diversity in clinical trials, health justice, mental health, and health technology. And I encourage you to attend sessions throughout the day. Tomorrow, there are sessions, a day-long tech summit. If you know people who would be interested in the summit, encourage them to log in and register at chci.org. Again, that's chci.org. And thank you for joining us.